Okay, once again, thank you, Jason, and thank you to Channel 14 for allowing me to come in and give kind of an update on the coronavirus. And I'm looking forward to a week, and I'm not sure when that'll be, but I'm looking forward to a week when we've actually got really good news to report. But unfortunately, that won't be this week. Wisconsin is one of 7 states, actually, that has just recently had new daily records, and I believe it was yesterday our highest record day of new cases was at 764. We now have 6,300 active cases in Wisconsin, and our death toll is at 809 deaths at this point. We currently have 3,726 people hospitalized. Confirmed cases in Wisconsin is now nearly 34,000. So those numbers are certainly not real encouraging. And in Kenosha, we've had 44 people die, and we have 1,666 active cases. So we have to remember the fundamentals at this point. We need to make sure that we are continuing to wash hands and not to touch our face and to social distance and wear masks in public whenever possible. All of the attention has been kind of given to the Southwest, Texas, and also Florida, but California and Arizona. But Wisconsin is one of those states where I think that because we have had a lower number of deaths lately, that people are getting perhaps a little bit too comfortable. And there's a couple of reasons probably why we're experiencing less deaths. First of all, I think that doctors and hospitals have been learning a lot in this process and have better treatments available for those who get very sick and end up in hospitals. And also now we're having a younger population that is getting it with perhaps a lower mortality rate. But the mortality rate in Wisconsin is still 2.4% of the people who get it, and Kenosha is a little higher than that. It's at about 3%. So this remains like a really, really serious situation, and there's over 555,000 people worldwide that have died at this point. So this is not something that can be taken lightly. And now there's been a lot of debate in the last week or so in terms of what to do about schools reopening. And I'm sure just like in Wisconsin, school districts all throughout the country are trying to figure out what's best for their individual schools in terms of the infrastructure that they have, in terms of the parents, some parents being worried about sending their kids back into a public setting. Perhaps they have a weakened immune system, or they have an underlying condition that they don't feel is safe. So there's alternatives that are being kind of baked into the plan that school systems have to come up with, and certainly I think that they have an amazing job that they have to do here in the next few weeks before they go back to school. And so there's still a lot of different things going on in the Southwest. We have hospitals that are at or nearing capacity, and no end in sight in terms of their spikes. So we have to remain vigilant in terms of masks. We know that masks are effective in not only protecting the person wearing the mask, but the people who are around them. And Dane County and also I believe Shorewood have just enacted mandatory masks while in public. I believe that Milwaukee is scheduled to vote on that next Monday, the city council there. So there's certainly a lot going on in terms of preventive actions being taken to stop the spread, but we need to remember the fundamentals as we go forward. And just also want to say that people should not hesitate to call my office if they're still having problems with unemployment. And we know that people have been calling our office, and we've been successful at getting a lot of those people who call. We've been successful at kind of shepherding their case through the system, which has been problematic because of the essentially handle just a small percentage of the amount of claims that we have taken. So people should continue to call my office if necessary. And also, if you're having trouble in terms of alcohol or drugs, or if you're having depression problems, feel free to call my office about that too, and we can steer you in a direction of, perhaps getting you a counselor or a guidance counselor, or just something to deal with, kind of the isolation that you might be feeling if you're not feeling safe to be out in public just yet. So if you're having any of those problems, feel free to give my office a call. And like I started out by saying, Jason, I certainly hope that one of these weeks I'm going to have good news. But we had heard early on that it was likely to go away when the weather got warm, and now we know that that's not true. And a lot of the experts are saying that we are still in the first phase of this, and that we can expect another one come fall, and we're not even out of the first one yet. So this is a serious situation. We should avoid huge crowds whenever possible. Certainly the demonstrations that have gone on, those are huge crowds, and if you're demonstrating, you should certainly be wearing a mask and social distance as much as possible. And if you're at a family event, or if you're at an event other than your very close circle of friends, you should certainly have a mask handy and throw it on in the event that all of a sudden you find yourself surrounded by people that you don't really know have been safe and sound. So, Jason, I just want to thank you once again to Channel 14 for this opportunity, and just encourage all of your listeners to just remember that this is far from over. We're not out of the woods yet, and I look forward to talking to you again next week. Maybe we'll have good news. I'm hopeful.